Hello, my name is Dr. Urzola. I'm a board-certified plastic reconstructive surgeon. Over the last 10 years, I've been treating patients from all over the world. This video has a purpose to inform medical tourism patients on what the trip to Costa Rica involves.
The U.S. is the largest single market of tourists to Costa Rica, totaling nearly 40% of all visitors within millions of American visitors in 2015. Doctors are board certified and a majority have received specialized training from worldwide renowned medical and dental institutions abroad. Also, American patients can have as much as 60% more savings by doing the same medical procedures in Costa Rica than in the US. Because Costa Rica is home to top private and public accredited hospitals and clinics. Dr. Urzola began his undergraduate medical studies at the Ibero-American University in San Jose, Costa Rica. He received his training in plastic reconstructive and aesthetic surgery in the University of Milan in Italy, and furthered his training in microsurgery at University Henri Poincaré in France. He also did a fellowship in facial aesthetic surgery in Polyclinique de Gentil in France, and a fellowship in body contouring and post-bariatric plastic surgery at the Ramsey Surgical Center in New Jersey, USA. Dr. Urzola is currently the Vice President of the Costa Rican Society of Plastic Surgery. He's a member of the Italian Society of Plastic Surgery and the European Society of Aesthetic and the American Society of Aesthetic Surgery. Dr. Urzola speaks 4 languages, including English, Spanish, Italian, and French. He is a board-certified reconstructive and plastic surgeon who is known nationally and internationally for being committed to bringing a high degree of surgical expertise to complex cases of reconstructive and cosmetic procedures.
An en-bloc breast implant removal consists in the careful dissection of the capsule containing the breast implant. The better this dissection is performed, the higher our possibility to completely remove the capsule and take everything out from your body. Every time I do an en-bloc resection, I take videos and pictures of the en-bloc procedure being performed and the breast implant contained by the capsule once it's out of your body. In that way, you can be 100% sure that a full 100% en-bloc procedure was accomplished and that there's no leftover capsule left in your body. The reconstruction that follows the breast implant resection in en-bloc will depend on an individual basis, and there are several alternatives depending on the size of the breast implant, the amount of fat that we can graft through a liposuction, and the amount of fat that we can actually inject in your breasts once we reconstruct them. This depends on the amount of breast tissue that you have in your body and the amount of fat that you have in your body. And we analyze this during consultation on an individual basis to fix the best possible reconstruction alternative for your case. It is my preference to be able to do the reconstruction on a single time, and in this way we are capable of lowering the psychological impact that removing a breast implant will have in the way you look. It is very important for patients to understand that each case has to be analyzed individually. Sometimes some things can be done on a patient that cannot be done on another patient, and this is the most important thing. But I am here to help you fix the best possible combination to fix your breasts in the best possible way. When the decision to perform a fat lipofilling to increase the size of your breasts is taken, we will address how many areas of liposuction we need to do, and we will address the amount of recipient breast tissue that you have so that we can decide the size of breasts we can accomplish. The size of your breast will be directly proportional to the amount of fat we can graft through the liposuction and the amount of fat we can inject into your breasts. The technique involves a very careful injection of the fat that we mix with platelet-rich plasma extracted from your own blood using a very small cannula in a multi-level arrangement. In this way, we create a mesh that supports the breast tissue and gives the best absorption of this fat. The platelets are very important because they will produce angiogenic factors and growth factors that will stabilize this fat and increase significantly its uptake. In some patients, we can also use stem cells. These stem cells we graft from your own fat, and we use a process to isolate them and be able to inject them mixed with your fat into a very, very high concentration. This will increase significantly the uptake and the rate of healing of your breasts. Once I have your pictures and medical records, my staff will contact you for us to set up an appointment on FaceTime or Skype. And during this consultation, I will answer all your questions, and together we will discuss the best approach for your specific needs.
Hi, I'm Claire Weinheimer, and I am one of Dr. Victor's patients. I came across Dr. Victor through a Facebook support group for breast implant illness. A good friend of mine actually recently used Dr. Victor for her surgery. She had recommended him to me, and I live stateside, so it was a little bit of a hesitation for me to come all the way to Costa Rica to have a surgery done. But the more I researched all of the work that Dr. Urzola has done and talked to probably dozens of other women who have either had work with him or had spoken with him, I knew that this was the right place for me to come. What really sealed the deal for me in choosing Dr. Urzola was the FaceTime consultation that I had with him. I am a firm believer in how I feel, like when I walk into a room or when I meet somebody, the perception that I have. And the minute he sat down and turned around in his chair to have a FaceTime consult with me, and we started speaking, I felt like I was hanging out with a friend, someone who truly cared about me, someone who genuinely had my best interest at heart and not his lawyer's best interest at heart. And I just loved how he took the time to explain things in detail. He drew me pictures. I like detail-oriented people. And he answered all the questions that I had. I never felt uncomfortable around him. And I just truly felt like he cared about me as a person, not me as a dollar sign. And that was a very, very, very big deal for me. I had had a couple other consultations with surgeons in the States that I did not get that same feeling from. So that was a big selling point for me.
Once you have taken the decision to travel to Costa Rica to have a surgery performed with me, my staff will contact you and they will give you all the logistics and information you require for your travels.
Hello, my name is Paola. I am one of Dr. Victor's patient coordinator. Today, I will be telling you everything you need to know on scheduling your surgery. The first step is to contact us. You can do this either by email or phone. Once you have made the first contact, I will be telling you everything you need to know in order to continue with the process. The second step will be for you to send us some pictures. These pictures are very important because with this, Dr. Victor will be able to determine what is the best option for your procedure. These pictures, along with your medical records, they need to be sent by email. These pictures, they need to be in different perspectives. They need to be front, on the back, and also on the sides, from left to right. Once we have received these pictures, we will schedule a Skype call, conference call, or a FaceTime so that you can meet Dr. Victor and he can tell you everything you need to know regarding the surgery. Once the Skype call has been completed, we will be sending you a price quote. This price quote will include everything you need to know in regards to medical fees, from the OR to the medications. No hidden cost will be presented in this quote. Once you have received the price code and accept it, you will need to contact Chatica Ranch, which is the recovery center that we highly recommend you stay. After you've seen their schedules and figure out a date that you wish to come, and depending on their availability, you can go ahead and arrange your flight tickets. After everything is set up, you will need to send us a copy of your passport and also a copy of your flight itinerary so that we can have that all ready and know exactly when you're coming. The time frame for you to stay in Costa Rica depends. This will be determined on the amount of surgeries that you have. If you're able to do it all in once, you can stay between 10 to 15 days in Costa Rica. If the surgery requires to be split in two and two different procedures need to be done, the stay will need to be at least 30 days in Costa Rica. This will be determined by Dr. Victor once the consultation is over. Before coming to Costa Rica, there's a series of tests and requirements that you need to accomplish in order to come, including an EKG, which is an electrocardiogram, a complete blood count, clotting times, and also your blood type. If you're having breast surgery, depending on your age, you will need to perform a mammogram and also a breast ultrasound. These tests need to be sent before your arrival to Costa Rica in order to determine if you're a good candidate for surgery. In order to prepare for surgery, there are certain requirements that you need to fulfill. Here is a list of the requirements prior to surgery and days before your surgery that you need to know. Preparing for surgery. In the days before the intervention, remember not to take any medication without consulting Dr. Urzola, including those used for pain and colds and bearing aspirin. If you take aspirin 15 days prior to your procedure, we will have to cancel the surgery, since aspirin will thin your blood and increase the risk of bleeding. Notify any change of health if you have colds, infections, or diarrhea. Let us know if you're taking or have taken any medication to regulate blood pressure, blood clotting, heart conditions, to treat diabetes, rheumatism, nervousness, depression, mental illness, birth control pills, tea, herbs, vitamins, and supplements. The results of the preoperative evaluation must have been previously reviewed by Dr. Urzola to confirm that your health allows you to undergo surgery. Do not smoke for 1 month prior to the intervention and for 1 month after the procedure at least. Do not take aspirin or anti-inflammatory drugs at least 15 days prior to the surgery. Do not drink alcoholic beverages 1 week before the surgery. You need to suspend all vitamins and supplements at least 15 days prior to the surgery. You may only take vitamin C. You are not allowed to stay near pets, at least for 1 month after surgery. The day prior to surgery, eat light and do not drink alcoholic beverages. Extreme hygiene helps to prevent post-operative infections. Do not take anything by mouth, food, or liquids with a total fasting of 8 hours before the time of your surgery. For example, if your surgery is scheduled at 8 a.m., you shouldn't drink or eat anything after midnight. If you need to take any prescribed medication allowed by Dr. Urzola in the morning of the surgery, do so with the smallest amount of water possible. If you have any questions, don't hesitate to contact our personnel by email or by phone.
The day of the procedure, you will be brought to the clinic where my staff will receive you and help you through the admissions process. You will also have a physical examination and your signs will be taken. If you require platelet-rich plasma, you will be brought to the lab where it will be withdrawn from your blood and processed. You will be then taken to the OR where my anesthesiologist will receive you. An IV line will be placed in your arm and then I will come and do the pre-op markings. If you have any last-minute questions, I'll be very happy to answer them. We will then bring you into the OR and put you under. During the procedure, all the staff that works in there is very well trained. I always work with the same 2 anesthesiologists and I always use the same OR staff. In this way, we minimize to a maximum the possibility of errors.
Very likely, what you will consider when deciding to go ahead and have surgery is how safe it is for you to have the surgery and the anesthesia. My field, anesthesiology, has evolved a lot in the last 40 years. Things are very, very safe now. We have top-notch anesthetic machines, top-notch monitors, and the drugs we use are very safe. So it's something that you shouldn't worry about when deciding to go ahead and have that surgery that you want to have done. Inside the OR, it is my job to keep you safe, to keep you completely unaware of what's happening in there. And with the medications that I have and the anesthetic gases and the equipment that I have, I'm able to do that in a very timely manner. I don't think you should worry about this part of your decision because you're in very good hands.
Okay, so many patients have asked me how the platelet-rich plasma works with the fat that we transfer. Okay, so I saved a little bit of fat, okay, basically kept it there after I did all the breast augmentation with the fat transfer. This I saved just to show you exactly what happens with the platelet-rich plasma. So I'm going to remove the envelopes of the syringe, and as you can see, it becomes, you know, something I can roll in between my fingers. This is how fat looks, you know, when you treat it with platelet-rich plasma. Once your surgery has been completed, we will move you to the recovery room, where we will keep you in average 1 hour. In some cases, this stay can be a little longer until you're ready to move you to either to the recovery center or to your room. We will decide this during the pre-op consultation.
After the surgery is completed, you will see Dr. Víctor next day, and then you will start the post-op therapies. If you have liposuction, you will need to have lymphatic drain massages. This is mandatory.
After your surgery, you will have to do several lymphatic drainage massages. These lymphatic drainage massages must be done in my office with our physiotherapist, whom I have trained for the last 10 years. These are very important to ensure a good result in your surgery. And I will use these appointments to follow up on your after your surgery, and they're part of the follow-up care. Since you're for such a little time in Costa Rica, it is important for me to see you as many times as it's possible.
The hyperbaric chamber is optional. However, Dr. Urzola recommends to have at least 3.
One of the things that we require our patients to do after surgery is to visit the hyperbaric chamber. A hyperbaric chamber is a machine in which you lay down and we infuse high-pressure oxygen into your tissues. This increases significantly the uptake of fat that we transferred and increases the rate of healing of your incisions.
The day after surgery, I went for my first hyperbaric oxygen chamber treatment, which helped with recovery tremendously. You just lay in this chamber for about an hour and a half, and I did a lot of sleeping, really. And then the second day after surgery, I had my first lymphatic massage, which was magical and amazing. And I had 2 more of the hyperbaric oxygen treatments. All in all, the protocol of using the hyperbaric and the lymphatic massage made a tremendous difference in the speed of my recovery. 7 days out post-surgery, and I'm walking around with no help of any kind. I'm taking my own showers. I can raise my arms above my head, you know, all these little things that I did not experience when I got the implants originally put in. So all in all, my experience has been, it's been magical. As cheesy as that may seem, I really didn't know what to expect coming to another country to do this surgery, but I cannot recommend Dr. Víctor's work. It's just, I cannot recommend it enough. I've seen myself in the mirror taking my garments off, and it's pretty awesome.